My name is Dr. Steve Sauerberg, and I'm a candidate for the United States Senate. I want to thank you all for joining me here in Hinsdale to discuss an important issue facing American families and individuals today, and an issue I know quite a bit about, health care. Before I begin, I want to say a special thank you to Dr. Jerome Hines for so graciously hosting us at this facility today. Unlike Dick Durbin and other career politicians in Washington, when I talk about health care, I speak with the benefit of a lifetime of hands-on experience. Let me tell you about my background. For over 25 years, I have served local communities as a dedicated and caring family physician. I was born in Berwyn and raised in LaGrange, where I attended public schools. I attended McMurray College in Jacksonville, Illinois, and was accepted into Rush Medical College's program, where I finished my 4th year of college and my 1st year of medical school simultaneously. I returned home for my residency at LaGrange Memorial Hospital and was honored to be appointed chief resident my final year. I then served as assistant and then associate director of the residency while teaching family medicine for the next 4 years. Then I started my own successful practice in 1985, which has grown into the Family Medical Center of LaGrange and now serves over 10,000 patients. Being a family physician is the most rewarding profession in the world. Patients trust me with their health and, in some cases, their lives. Sadly, I have to report to you that our healthcare system has become too confusing, too expensive, and inaccessible to many Americans. Professional politicians have had their chance. They have talked about solving our healthcare crisis for decades. What has all the talk and empty campaign promises gotten us? A healthcare system with over 40 million uninsured, skyrocketing healthcare costs, and a runaway frivolous lawsuit system driven by unscrupulous trial lawyers looking to make a buck at the expense of patients and providers. Liberals offer the same answer to healthcare that they do for every other challenge facing our nation. They say we need more big government. They are wrong, and let me be crystal clear about this. Experience has proven to me time and time again that socialized, big government-controlled medicine will destroy healthcare quality in America. It is not surprising that socialized medicine is not the answer, because let's be honest, a government that can't secure its borders and now suffers tens of billions of dollars of Medicare and Medicaid fraud annually is in no position to run the nation's entire healthcare system. A government that can't be trusted to spend our tax dollars wisely and to live within its means cannot be trusted to manage life and death decisions of families here at home. My prescription for reform is straightforward. Your health care, your choice. My plan empowers families and individuals and trusts them to make their own health care decisions, not nameless, faceless government bureaucrats in Springfield or Washington. My plan doesn't rely on layer after layer of new, ineffective government bureaucracy. Instead, my health care plan employs free market principles and the private sector to create a system that emphasizes individual and family ownership, restrains runaway costs, increases consumer options, reins in the burden that frivolous lawsuits impose on consumers, removes barriers to cutting-edge innovations, and most importantly, provides access for all Americans to affordable and high-quality health care. By increasing competition, lowering costs, and encouraging innovation, my plan will not only increase access to high-quality health care, but will also serve to reduce the costs and increase the availability of critical, life-saving, and life-extending prescription drugs. The basics of my health care plan are simple. First, in order to promote coverage for every man, woman, and child in the United States through the private sector, the government needs to encourage portability, competition, accessibility, and individual ownership of quality medical insurance. Second, to protect patients and providers to dramatically reduce health care costs, we need to end frivolous malpractice lawsuits. Third, we must encourage innovation and promote best practices at all levels of our healthcare system. Finally, without ending fraud and abuse in Medicare and Medicaid, we cannot fundamentally reform our healthcare system. This urgent task can be done if we have the will. Elect me, and I will lead and win this fight. First and foremost, my plan emphasizes individual ownership of medical insurance. Tax benefits currently given to employers for providing insurance to employees will be converted to tax rebates for individuals and families or health vouchers for those who don't pay federal income tax. My plan provides an individual with a $2,000 tax rebate and families with a $5,000 tax rebate. Individuals and families who have secure insurance for less than the amount of their tax rebate can put the difference into tax-free health savings accounts, which can then be used to pay for other medical expenses such as insurance deductibles. Giving families control over their insurance, the insurance they purchase, will also ensure that individuals get the coverage most appropriate for their age and circumstance, and also customized to their individual or family needs. At the end of the day, families and individuals should be in charge of their health care decisions, not nameless, faceless bureaucrats in Washington or Springfield. In addition to facilitating individual ownership, we must encourage portability within our healthcare system. Individuals and families must be able to maintain their desired health insurance coverage regardless of whether they move residences or switch jobs. Medical records should be computerized so that emergency physicians, primary care providers, and specialists can access an individual's medical history in a timely, potentially life-saving manner wherever and whenever a patient requires care. This portability of health insurance coverage and medical information is critical to fostering true consumer choice and efficiency in the healthcare industry. My plan will bring increased competition and will decrease healthcare costs by allowing individuals and families to purchase the healthcare coverage of their choice in any state. My plan will also impose penalties on insurance companies that refuse to provide coverage due to pre-existing conditions or any other discriminatory practices. We can't allow insurance companies and state bureaucracies to prevent consumers from selecting and purchasing their desired health care plans. By forcing insurance companies to compete locally, statewide, by region, and nationally, rather than just on a state-by-state basis, my plan will reduce the cost of health insurance, enhance quality, and breed innovation. In order to protect patients and providers and to dramatically reduce healthcare costs, we need to end frivolous medical malpractice lawsuits. Under my plan, the federal government will offer financial assistance to states to establish administrative health courts tasked with determining whether a healthcare provider is responsible for a patient's injury, and if so, what remedy is appropriate. These administrative courts will include a panel of 7 independent experts, 3 legal experts, 3 medical experts, and 1 citizen advocate who will serve as chairperson. If either party to a suit is unhappy with the decision of an administrative health court, access to traditional state court routes will be available. However, a party appealing a decision of these administrative courts will have to agree to pay both parties' legal costs in the event that the appeal fails in state court. Administrative health courts will lower health care costs and save taxpayers billions of dollars by removing frivolous lawsuits from state judicial systems. Finally, no discussion of health care reform will be complete without addressing rampant Medicare and Medicaid fraud. Under my plan, we will create a Medicare and Medicaid fraud task force housed in the Federal Bureau of Investigations. The Medicare and Medicaid fraud task force will consist of FBI agents and local enforcement officials and will be responsible for cracking down on the Medicare and Medicaid fraud cartels that cost taxpayers tens of billions of dollars each and every year. Fraud and abuse in the Medicare and Medicaid systems constitutes a serious and growing problem, and one that greatly adds to the overall costs and inefficiency in our healthcare system. The Your Healthcare, Your Choice plan calls for tough punishment for those who abuse the system, including mandatory one-strike and you're out sentences for those found guilty of Medicare and Medicaid fraud. In addition, my plan will encourage states to crack down on fraud in their own Medicaid systems by offering them the ability to keep 1/2 of all dollars that are recovered as a result of elimination of fraud. Now is the time for real change. Unlike career politicians, I offer more than just empty rhetoric and promises of big government and bureaucratic-driven solutions. I offer sensible ideas and fiscally responsible solutions to fix the healthcare system. Working together, we can make it happen. Real healthcare reform begins right here. We can take Illinois values to Washington and put healthcare in America on a brighter course. We can make healthcare more affordable and available to all Americans. However, I can't do this alone. I need your support, and most of all, I need your vote. Thank you, and God bless you all.